say, and actually I tried to
من الانترنت ضعيف.
session we don't have a source there, so I have asked Dr.
Ameed.
It's to bring this book out. Dr. So said yes, so I'm grateful for that. That means we can have everybody today. Okay? Thank you, Dr. for allowing us to continue with the conference. Okay? Thank you. So we give percentages, okay, from 11:50 now. So it should be 12, okay?
دكتور عادل إلي الحين الآن؟
Yes, please. Yes, please.
Okay, خليني I will share my screen. واضحة ال presentation. دكتور عادل, thank you very much for inviting me. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أكرمين. الحقيقة بالبداية I would like to thank the Arab, the AAA in the UK for this kind of invitation. I really appreciate this cooperation, and I think what I'm going to discuss this afternoon by pioneering the AI in dental and medical healthcare. And in my presentation, because we have so many diverse audience from medics, dentists, engineering, I'm going to talk in a general terminology, and I will focus on actually on two things: the organization which we registered a few months ago. It's the Arab Organization for AI in Healthcare, which the idea is very similar to the AAA UK, is to promote AI among the Arab countries, and I'm going to talk this, and then we go through we ask one of the main powerhouse in feasibility study to conduct for us a feasibility study on how much the Arab country are spending on AI during the last few years. This is also I'm going to present. So let's kickstart the process. Now, why this topic matter to us? Well, as we all felt in the last maybe 5 to 7 years, that AI is really reshaping everything in our life, especially if we talk about dentistry and medicine. Now, in dentistry and in medicine, AI is a very important agent and helper to the doctors and dentists to perform, and it's like Errol Tobel, who's like one of the main sort of scholar in the AI in healthcare, this physician, cardiologist actually, he said that imagine AI as a huge stethoscope, which is true. This stethoscope could diagnose in a few seconds your whole clinical history, your whole medical terminology, whatever disease you have, your genome, your the whole microscopic, and any blood test could digest this in a few seconds and give you a suggestion to the doctors or the dentist if it is X-ray, so he could perform perfect diagnosis and also give you a treatment plan, whether short term, medium term, or long term. And the beauty of this, that some of the Arab nations are really emerging as a leader in the AI in healthcare, and that's what we're going to discuss later. And also I have a special interest in the ethical collaboration between the Arab country, because I have a special interest in the ethical AI in healthcare, which I'm going to also to go through it very quickly. Now, For the global cooperation between, in the landscape, as I mentioned, AI could help doctors, dentists, to give them an immediate AI-driven diagnostic, whether as my colleague earlier mentioned about cardiology. Now we're all wearing Apple Watch. Now with the Apple Watch, you have an AI program which can detect whether you have atrial fibrillation or not, and can do ECG for you. This is just one example, but in dentistry we have, the program where it could show the dentist where is the disease, whether caries, periodontal disease, or ulcer, in more sort of accuracy, like 80% better than the dentist, because the naked eye sometimes cannot detect very, very subtle sort of difference in the pathology. So as in the oral microbiology and general pathology, now to diagnose a slide, it's just an amazing, where a lot of people think that the future will have a reduction in two specialties in medicine: radiologist and pathologist. Medical imaging, robotic surgery. Now, I had the privilege to, in 2019, I was in Los Angeles, and I saw one of the robotic surgery where it performed an amazing prostatectomy on a patient with a prostate cancer. It took the robot half an hour with no blood loss. Normally it takes 4 or 5 hours and your patient will lose a lot of blood. But this is the future, and the robot doesn't take holiday, doesn't feel sick. But we have the ethical challenges which I'm going to talk about. Now, what are the main AI hub in the Arab world? Well, unfortunately, there is a huge difference between different countries, and I think when you look at it, it's to do with the economy. The country with a good economic status, they are now pioneering, like Saudi Arabia now. Saudi Arabia was the first country in the world to publish in 2019 the ethical protocol for AI in healthcare. Also, we have UAE, that's also doing some projects, especially Sheikh Mohammed bin Zayed University for AI, which is promising. Not sure whether this is just marketing or they are doing it. I haven't get enough information, but I know the Kingdom of Saudi Arabia is leading the way. Qatar also starting some program. Jordan have an amazing, because of their education system, they have a lot of AI specialists. So as in Egypt also leading the way in some of the main sort of, program in the AI, and Morocco. Unfortunately, the rest of the country, the rest of the Arab country is still lagging behind. Now, the Arab innovation, if we go through the history, I went through with the Arab League and some of the organization for the, medical association of the Arab country, and some of the executive bureau of the Minister of Health in the Arab country. We started in 2018 the triage system, 19 starting introducing AI in radiology, buying some software from the state and from Europe. And then, of course, we don't forget that during Corona epidemic, all the epidemiological sort of forecasting was used by AI in all I think all Arab countries, especially in Saudi Arabia. In 2021, telemedicine, as we know, in the Arab world we have problem that we don't have enough medics and healthcare providers for all the population. We are still lagging behind the WHO ratio. So telemedicine could really compensate on this deficiency. As far as the Arab innovation, if we talk about my specialty in dentistry, radiographic interpretation, the AI could give us 90% prediction dentists with the naked eyes could give you between 60 to 70%. Orthodontic planning with the new, that the aligners and, wireless orthodontic using the 3D printer and the prediction for treatment planning. Implant prediction, whether this implant will be successful or not. Also AI now is using, it's give us an amazing opportunities for dentists. CAD/CAM, the computer assistant design and computer assistant manufacturer, where, and if you remember in the old days, if you need like a crown or a bridge or any sort of Taj, we call it, you need to wait 2 weeks, 3 weeks until, dentists take impressions, send it to the lab. Lab will take some 2 weeks to fabricate it, put some temporary will break down, you have a lot of pain. Now, in one session, the dentist can prepare the tooth, scan it with a scanner, send it to the computer, to the software. You design whatever you want, crown, bridges, veneer, and send it to a milling machine. In 20 minutes you have it and you fix it back. You don't need to wait. And this is an amazing achievement for the artificial intelligence. Of course, practice optimization, marketing, stock control. This is now, it's make our life easy as a dentist. Dental education, in my days, like 40 years ago, we used to struggle to find, the cadaver to do, to learn anatomy, to see how our professor will prepare a tooth or make an impression. Now, with AI and the simulation, make life easy for everyone. What about the case study? Well, in the vision of 2030 of Kingdom of Saudi Arabia, I think Saudi Arabia now is leading the way, not only in the Arab world, not only in the Middle East and North Africa, but I think globally. The Vision 2030 stated that in the year 2030, 30% of the national gross product of Saudi Arabia should come from AI, and they are going this way. They set up in 2020 SDAIA, which is Saudi Data and Artificial Intelligence Authority. They developed an amazing smart hospitals. I went to NEOM and see some of the smart hospitals. Amazing, you have sensors everywhere. Patient could stay in their home. They measure their temperature. Toilet has special sensor to measure whether the urine has any bacteriological. It is just, and then you have the drones could bring medication to patient, and also quantum AI. Saudi Arabia was one of the first country in the Middle East and North Africa to introduce quantum AI in so many hospitals in the Saudi Arabia. And only a few months ago, they established the Hexagon. This is like a major data center. It's one of the biggest data centers in the world in Riyadh. They open it to be the hub for different AI. As I mentioned, United Arab Emirates, they have AI robots. They use, I don't know, anyone who went to Dubai airport, you see the AI powered robotic everywhere. They started digitizing the health record 3 years ago, and they have a very good global partnership with many countries which are highly developed in AI. Now, this is the sort of the main finding from the study, which I gave to one of the main sort of research companies called Market Research Future 2024 in MENA region in the Middle East, North Africa. In the year 2024, the country spent 435 million. This is in dollars, and 2000. But the prediction that in 2033 it will be 8.3 billion dollars will be spent on. And now just the Saudi Arabia, they put 100 billion Saudi riyal on AI for the next 5 years. In Saudi Arabia, also the feasibilities show us that in 2024, $211 million was spent, and they expect in 2030 it will be nearly a billion. It's 805 million. Now, the compound annual growth rate. This is sort of one of the indices they use to see how much is the growth rate. In MENA, it will grow in nearly 40%, and in Saudi Arabia, it will grow 26.1. Now, the key forces behind growth, as I said, the government investment. That's why we see like Saudi Arabia is leading the way, because of the economic power of the kingdom. The vision, which also adopted by both Saudi Arabia, UAE, Qatar, and some other Arab country, and also the need to adopt the clinical application, diagnostic, drug discovery, and AI-assisted surgery through robotic, as I mentioned. And King Faisal Specialized Hospital, which is a tertiary hospital and one of the biggest tertiary hospital in the Middle East, they adopted surgical robots in all specialty, in dentistry, in neurology, and general surgery. Also, the digital infrastructure is already set in a lot of Arab countries. They have, as I mentioned, smart hospitals, the digitization of all the health records, and AI health market reach, as I said, it will reach, according to the study, by 2029 to nearly $2 billion. Now, the organization which we registered, this is like very similar to the concept of the AAA. We know that there are so many AI scientists all over the world, especially in the States, Canada, Europe, and China. They are Arab. So what we are attracted, majority of them within this organization, and this is an open invitation for everyone to join the organization, anyone with AI experience, because what we would like to do is to bring this experience and promote it to the Arab country, to our land. So, because some of our countries, unfortunately, lagging really behind all these countries. So we'd like to promote the concept of AI in healthcare to all the Arab countries. And the ethical implication of AI is that the very, very most important thing is the patient safety. Because if you think about robotic surgery, if you have in the middle of a surgery and then you have a hacker intercept into your patient will die. Transparency, AI should be explainable to the patient. The responsibility should be also explained. Who is responsible? We're still discussing. Is it the company who designed the algorithm, or the company who built the robot, or the doctor who's managing the robot, or the hospital, or so there's a lot of questions need to be really answered about how transparent is this AI in healthcare. And fairness. Unfortunately, bias still in the AI, because a lot of algorithm was done on a white Caucasian, and there is a very important incidents happened in the state where Google Health developed a program to diagnose breast cancer, and the algorithm was fed by data from a white females, and when they adopted on a black female, the algorithm couldn't detect any neoplastic cells in the breast. So 5 patients died because of this program, and that's why they stopped at Google Health. They stopped, and this is part of the bias. So that's why we need, in the Arab world, we need our data. So it will be the data and the algorithm to to design will be from our patient, from our not from Caucasian or from Chinese. And of course, privacy, very important. Data is controlled by the algorithm and should be used in a way that we should have some kind of regulation to control it. I mean, when they ask me about the origin of AI, I always say the origin of AI started in our region, because when we use algorithm, Al-Khwarizmi is the Arab scholar who wrote his book about mathematics in Baghdad during the golden era. The science of logic was started in Mesopotamia and in Egypt, in these two amazing civilizations. So all the sort of foundation of AI was started in our country, in the Middle East. So the value, justice, dignity, Islamic bioethics and the other religious bioethic we are in our region is really responsible for giving this. What challenge do we have? Well, in the Arab world, unfortunately, we have a data fragmentation. As I said, some countries, they are digitizing all their health record. Some countries, they're still using paper and it's not unified. So if you want to have a unified Arab data in healthcare, you should have the same software or the same program used in all Arab countries. We don't have Arabic database. All the algorithm, all the database, all the data used now, we either buy it from Canada or buy it from China or buy it from another Western country. There is a regulatory gap. There is no unified regulation. As I said, Saudi Arabia was the first country to establish this regulation about how to control ethical standard within the healthcare using AI, but other country not, so we need to unify it. And are we ready for AI? No, we're not. Are we teaching AI in our universities? Not all universities. We're not ready, unfortunately, in the Arab world for this coming and must come technology, which is an artificial intelligence in healthcare. What are the opportunities for the leadership? Well, we need a unified Arabic database in the Arab country. We need to have regional artificial intelligence modules. We need to have the Center for Excellence as we have it now in Saudi Arabia and in Qatar and in Egypt and Jordan and UAE. And we need to have a unified ethical governance to control the ethical dimension of artificial intelligence. As I said, I mean, China now is leading, China is leading the way in AI in healthcare globally. Why? For two reasons. First, China has an amazing data. They started digitizing, health record 10 years ago, and they have billions of data. And as you know, all of us, that AI live on data. Second, they don't have regulation. They could use their data. It's not like in UK or in Europe, you have GDPR controlling how to use the data for patient safety and privacy. In America also there is a strict regulation. In China they use the data as they like. And the third reason, in China there's a shortage of doctors and healthcare professionals. Huge shortage. So they're using the AI to sort of replace this and compensate on this shortage.
Doctor, it's time.
Okay, so I'm really finishing. AI in dental education, simulation, remote learning, curriculum design, and multilingual platform. And the main important things really, that we really need to see that these Arab Center for Excellence, like in Abdullah University, I'm glad one of our lecturer was from this university because they have an amazing Center for Excellence. So as Qatar Computer and American University in Beirut. And also, you know, AI in public health. We know, you know, Corona, we use AI to trace it. And so we are really, I'm very glad that you gave me this opportunity to mention that with the Arab Organization for AI in Healthcare, we're going to promote AI in healthcare in all Arab countries and close this gap between rich country and poor country, and using the Arab League for this, and they are helping me. So thank you very much for this opportunity, and if you have any questions, I'm delighted.
For Dr. Ala, it's started compared. So, quickly, any question, please?
I've got one question, if I may.
Sure. Sure.
Ameed, thank you very much for this insightful, you know, presentation about the healthcare and the application of AI in this sector. You mentioned that there is no common health database in the Arab world. Why there is not such database now, and how can we develop one, and what is the role of the Arab Health Organization on this?
Well, thank you very much. That's very important questions. Well, you see, in order to have data, you need to digitize all the health record. So in order to digitize, which means instead of, I don't know whether you remember in the old days, doctor used to have a file, write, you know, ask you what's your problem, how can, you know, what is the symptoms, what medication you take. This is called health record. He take history, he write his request for any investigation, and then he reached to his diagnosis, and he formulate a treatment plan. Nowadays, not all the Arab countries, they have this ability to have a digital healthcare system. They still using pen and paper. They used to an analog system. Analog system will give us no way in advancing AI, because in AI you need the data. We need the Arab, and that's what we are doing in the Arab Organization for AI in Healthcare. We are trying to stimulate some of the rich country to help the poor country to develop this digitization process, though instead of using analog to write the health data, they will use digital system, put it in a format that will be unified for all the Arab country, so we have enough data to feed the algorithm, and we'll have our own AI healthcare programs.
Thank you, Doctor. Thank you.
Thank you.
I'll go to Professor so please share your slides, please. Thank you, Dr. Ameed.
My pleasure.
Thank you, Dr. Ameed, for your presentation. More likely mine will be a little bit of a copy of Dr. Ameed. We crossed paths a few times in the past, both was a dentist and both of us have interest in education and AI as well. So I'm going to speak from the British side of the AI, not the Arab side, but Arab British in a way. But what's more important is I'm speaking about the importance of AI, the changes that we would expect into the dental treatments using AI.
Nice, Habibi, well done.
Right.
Beautiful, absolutely wonderful.
يعني كانت أكثر من 20 دقيقة.
24, 25. That's brilliant.